All right, let's get to the story about the conference that's taking place. It's seen over 1,000 registered delegates consisting of global health experts, policymakers and community leaders convening at the Durban ICC for the 7th African TB Conference. The summit reports that despite medical advances, TB remains the #1 killer, mostly in poor communities. So for more on this year's conference, let's cross over to our reporter in Durban, Minoshni Pillay. Minoshni, a very good morning to you. Talk to us about the conference, and I know you're joined by a guest as well, but how are things going?
Good morning, Leanne, to you and the viewers. Yes, we are past the halfway mark of the 7th SATB conference in Durban. And I just want to start off by recapping some critical stats that came through a very important plenary yesterday morning. Professor Kogi Naidu from Caprisa referring to the 2021 Global TB Report, saying that for the first time in over a decade, we're seeing a rise in the number of new TB TB deaths, and that TB remaining the top infectious killer worldwide, and the leading cause of deaths in people with HIV, which is quite critical for a country like ours, where we're battling a co-infection TB and HIV rate of over 60%. So quite an alarming statistic there, something that no doubt will need some work. But to tell us more and to take us forward on this matter, we are now joined by the conference chair, Professor Willem Hannekom, who is going to take us forward on what we have heard this week and what more we can expect. Prof, good morning. Thank you for joining us.
Good morning.
All right, Prof, so we are past the halfway mark of TB this year, SATB conference. Just give us an update. What have been some of the key developments, discussions that have emerged in the last 2 days?
So I think you've mentioned what I think is the most important data that have come out is that globally there's been an increase in the number of TB deaths after steady declines over many, many years in the world. But we also saw data yesterday from South Africa, which actually confirms that the same happened in South Africa. So I feel this is a real crisis for us. South Africa already has something like 60,000 people that die from tuberculosis every year. So we really have to do something about it. So the government has been very responsive, and I've been very impressed with what they have come up with. They've come up with what's called a TB recovery plan. And this is specifically to address what has happened because of COVID-19. So what happened clearly with COVID-19 is that because so much in terms of resources have gone to COVID and people have been locked away, etc., people haven't been able to access treatment or diagnosis even. So those have not been available, and now we have got a plan to get back on track. And it looks like we're already getting back on track.
That's positive news. But Prof, before we go any further, I want to take you back to a statement you made head on at the opening on Tuesday, where you addressed the matter of the withdrawal of key stakeholders, let's call it, aligned to the conference, most notably the World Health Organization, regarding one of your key sponsors for the conference. Tell us a little bit about this. What is the conference's stance on what has transpired, the relationship that now, we know news has emerged of the relationship between this key sponsor and the tobacco industry. You made a very strong statement. Tell us about this.
Yeah, this is a very serious issue that the World Health Organization and two other prominent partners have withdrawn. They really weren't sponsors of the conference, but we want their participation because they are our critical partners. And they withdrew because it turns out that the conference organizers, a group called FPD, have been funded or have received a little bit of funding from a front organization from the tobacco industry. So this is how the tobacco industry works. It works in devious ways. They weren't even aware that they were receiving tobacco money. But somehow the WHO picked that up, and they thought that was such a serious thing that they needed to withdraw. We had lots of discussions with them and with other critical stakeholders last week. In the end, we thought we needed to move forward, and we explained this to them also. TB is, as I've just said, is an incredible crisis in this country. And we cannot afford not to have all these stakeholders come at the last minute to address the critical issues in front of us.
Just tell us, for the record now, what is your relationship with the sponsor?
So the sponsor is an organization that has played a very important role in professional development in the health space for many, many years. They are people that run the South African TB conference, the South African AIDS conference every year, etc. So they invite an independent organizing committee, such as of which I am the chair, to organize this meeting every year.
Have you withdrawn relations with the sponsor going forward?
At the moment, we have not, no, but we are discussing the issues at hand also with the South African National Department of Health, and we'll have to see what we're going to do going forward.
All right, let's turn our focus back to the conference at large now. We know the conference has taken a 2-year break due to COVID-19 and the restrictions around that it brought. Are we playing catch up with regards to TB control in South Africa now in 2022?
I would say the indications are there. They're very early. It's too early to say. So TB is a disease that develops very slowly. Okay, it takes months for TB to come out. So it takes time, therefore, to develop data to see whether we are recovering. So as you know, we're sort of just over the hump of the COVID epidemic. So we'll have to see. But like I said earlier, I think the early indicators are definitely there that we're going in the right direction. So I'm very positive about this. I'm incredibly impressed by the plan of the South African government. But I want to emphasize that this has to be linked with other advances, the kinds of the new drugs, the new vaccines to prevent TB, the new diagnostics to diagnose TB early. And that's why we're having this conference, so that all those government stakeholders, the civil society, the academics, the researchers all can get together and look at how everything fits together.
So, Prof, we've heard you speak several times, throughout the COVID-19 pandemic. How then do we apply the will, the commitment, the finances that we saw? Obviously, very different, very different diseases. But how then do we apply what we learned during COVID, how it's possible to respond to something like TB that's been around for far longer? And like I say, we cannot compare the two. But how do we apply the principles?
Yeah, I think that's a fantastic question. As a person that's worked in TB all my life, mostly in TB vaccines, I'm incredibly jealous of the amount of money that went to COVID vaccines. Okay, at the core of this is the amount of money that's available for progress ultimately in a specific disease, and it's a pittance in TB compared to COVID-19. And why is that? And it's because we never had the advocates or the activists really in the TB world like we had, for example, in the HIV world, that have created the demand that we need for more money to come our way. Regardless, there are many other lessons that we've learned. So, for example, on the academic side, for researchers, the COVID world immediately released results and formed these consortia nationally, which allowed people to work together that never happened before. So we're actually going to start implementing exactly the same in tuberculosis. So hopefully we've learned some things. I still think the big thing is the money. TB is a disease of the socioeconomically dispossessed. And therefore, there are very few advocates, very few activists. Now, finally, at this meeting, we saw some activism. So we had a protest in the first session, which I was delighted about, because I've never seen that at a TB meeting. And that's what we need to get TB back on track.
So like you say, TB, a disease of the vulnerable, those most vulnerable, particularly in developing countries. Just finally, Professor, how do we take what we are hearing here in these halls to the people on the ground that are most affected?
Well, you're asking all the right questions today. So we can do nothing in TB control if we do not put the persons that are affected by TB absolutely central. So the persons central and the communities central in this whole effort. they are critical for guiding the interventions. And that is why we have this conference. At this conference, we have incredible representation from civil society. And these representatives take part on all levels, and they're very engaged, for example, with the South African government in the TB recovery plan that I talked about. They take part in all levels, and they're very keen to hear about the latest advances so that they can also try and push for those advances to ultimately get to themselves.
Professor Wilma Hanekom, thank you so much for your time. That's the chair of the SATB conference in its 7th year this year. Leanne, it's back to you.